Let's say the young person who goes out with friends, drinks heavily, gets on a bike and goes home. No problem yet. The risk of them having an accident and a head injury or even dying.
Hey, what signs do I need to notice about drinking alcohol? Since you're here and we have you with us.
Unless you teach people how to operationalize those within their context and what is possible within that context, it won't work.
There's a reason why they tell you to wear a seatbelt, but nobody listens to that either. Hi Abhijit, welcome to The Curious Case of. Abhijit is a psychiatrist and he specializes in addiction research and he also teaches. And mostly he does 50% he does research, except I found out that there's different kinds of research and there's something called implementation research, which is what you do.
Yeah.
Yes? Okay, correct. Anyway, which means that he actually goes and does the thing and then sees if it works and then comes back. So he doesn't just do the writing, he also does the thing and sees the impact on real people. Today we are going to talk about addiction. And I wanted to start from the basic question of what is an addiction, because people say I'm addicted to TV or people say I'm addicted to chocolate, or these days everyone is addicted to matcha.
When people talk about I'm addicted to some of these things that you spoke about, their conceptualization of it is I do a lot of this. I watch a lot of Netflix or I drink a lot of matcha and I enjoy it, and that's why I keep doing it. Whereas addiction is much beyond that, right? If I wanted to use one sentence to kind of separate or differentiate the two, it would be addictions as people talk about it in the lay language is enjoyment, and addiction in its real sense is a compulsion. And there's a big difference between the two. And there are some core things that will differentiate your love for Netflix from, let's say, being addicted to alcohol. And these core things include loss of control. So, for example, if you have an addiction to something, then once you start doing it, you will find it extremely difficult to stop it, even if you want to, which is not the case with some of these other things. The other core thing that you will see is a compulsion to indulge yourself in that activity, whatever that activity is. Like you get strong urges to keep doing it. There are things that happen around you, cues that kind of push you towards using that thing. You continue using whatever that thing is, even when it is causing problems for you in various domains of your life, whether it's physical health, mental health, social domains, occupational functioning. And despite knowing that it causing you difficulties, you will keep using it. You start readjusting your life around that addiction, right? So, for example, a lot of my time is spent in thinking about, if I've gotten, let's say I'm dependent on alcohol, a lot of my time spent thinking about how am I going to get the alcohol, spend a lot of time around actually getting that alcohol, then more time drinking that alcohol, and then further more time getting over the effects of that alcohol, right? So you're now adjusting everything around it. Like you wake up and you might have your drink, so you might not have a breakfast or whatever. You might go late to work because you have to have that alcohol. You might leave early from work because you have to have your alcohol. You might not come home after you finish work despite having home responsibilities. So you're readjusting everything around that. So these are some of the core things that come. And then there are other kind of more technical terminology, so to say. Like, for example, tolerance, right? What does that mean? It means that you have to start doing whatever that you are doing to which you are addicted to. Let's take alcohol, just for the sake of explanation. I'll just stick to alcohol for the moment. You start off with, let's say, drinking beer, and then you have 1 can of beer, 2 cans of beer, and that makes you feel good. Over time, those 2 cans are not enough to give you that same effect that you were getting before. So you kind of maybe go to 4 cans of beer. Over time, that doesn't help as much. So you move on to spirits. And then you start off with 2 pegs of whatever, rum or whiskey or gin. And that then goes up to 4 pegs and then a bottle. So that's tolerance. Your body, your brain is getting used to it. It's not giving you the same pleasure or effects that it was giving you before, and you keep increasing it. And if you become dependent on that alcohol, then you, when you stop alcohol, you develop what's known as withdrawals. Your body starts having different effects. You get tremors, you might get seizures, you sweat excessively, and so you get those withdrawals, the physiological withdrawals, and you also get psychological withdrawals. So broadly, these are some of the things, which I'm sure you'll agree are quite different from love for coffee or matcha or Netflix. So, yeah.
So when you start, you can't stop. If you're not doing it right now, you feel the urge to start doing it. You start to plan your whole life around being able to do that activity or consume that substance. And then the other two that you mentioned are kind of like, if I used to drink 3 cups of matcha, now I will need to start drinking 5. So that's like very specific to addiction.
Yeah.
That's a specific part of it, that you have to start consuming more of either the substance or the behavior or whatever it is. And the last one,
withdrawals. So when you stop.
And so then if I don't drink the matcha, then I really, really can't function, and it'll affect a lot of things. Okay, cool. Didn't know that the last 2 were specific to being addicted to something. There is a difference between substance addictions and behavioral addictions. Should we separate the 2 for this conversation? And if we should, just a little bit of why we should separate the 2.
Sure.
Because we talked about Netflix and we talked about matcha, and one is behavior and one is substance.
Sure. So what are the differences? Obviously, behavior and a chemical substance, right? So that's the basic difference. But how it starts working on your body, or let's say in this case, brain. In the case of substances, there is actually something going inside your body and actually influencing the brain, right? Something actually happening to your body and the brain, which is not the case with behaviors. So the entry point, so to say, for the start of the addictions is different. But once that entry point happens, a lot of the other things that, subsequently happen are quite similar in terms of what it does to the brain. And for example, the dopamine surge, or the changes, structural changes that over time happen to the brain because of the addiction. That would remain the same. Some of the symptoms or the signs that I spoke about earlier, that you're spending a lot of time thinking about it. There are cues that kind of give you the urge and the craving to indulge yourself in that behavior. You'll get withdrawals. But whereas in substances, you kind of get both psychological and physical withdrawals, like something happening to the body, like tremors, etc., and then, feeling restless and anxious. With behaviors, it's primarily psychological withdrawals and not physical withdrawals.
So I won't get a seizure from not watching Netflix, but because of the physiological things that
you might start feeling anxious, like, I need to watch this.
Correct.
Not watch. So the bottom line being, if you look at it from the perspective of the brain and the kind of the chemical changes that happen in the brain with neurotransmitters, to the brain, it does not matter whether the dopamine surge that is happening, or it doesn't understand that the dopamine surge is happening that's coming out of a bottle or from a betting app.
Yeah.
But as I said, the entry point remains different, but once the changes start happening, a lot of them are the same, and some of the symptoms of it remain the same. The impact probably, there are some similarities, like both could affect your occupational functioning, your social functioning, your family relationships, etc. But there's nothing happening physically. There's no physical damage happening to you in behavioral addictions. And behavioral addictions are relatively more easier to hide, relatively less stigmatized, and there are, in today's world, a lot of commercial substrates to some of the behavioral addictions as well. Like like uh, betting on sports. Like, it's legal in many parts of the world. Gambling illegal in many parts of the world. Among substances, there are some. So there's alcohol, there's tobacco, but then there are others that are, illegal. So there's those kind of commercial determinants that come into the picture as well that we need to think about.
Yeah. So because you're looking at it from the access you would have to the behavior, or like if a substance is illegal, then you also have to then figure out how to get that substance. Versus if something is legal, like you're allowed to gamble in whichever country, then you don't have to put in so much effort to be able to access that behavior.
Alcohol.
We love trivia.
Alcohol is the only substance in the world. Okay, only substance, and I'm not exaggerating here, only substance in the world which is legally available, which you can just go and buy, anyone can go and buy, which is directly or indirectly responsible for more than 100 medical conditions. There's no other substance. Like, I can challenge you to kind of tell me one right away.
Interesting. We should ban alcohol, guys. That's the message.
Not sure that works. Has not worked.
Banning doesn't work, yeah. Okay, so we'll be aware of the differences between substance addictions and behavioral addictions, but we can focus on the substance addictions today, because I feel like it's very important to realize the fact that when you're taking a substance and something is going inside your body, there's a whole bunch of other things, especially in the long term, that'll get affected by the fact that there is a foreign thing going into your body, doing a whole bunch of things to you as well. So we had done a previous episode with Dr. Azhar, who has lived experience of being addicted to alcohol mostly. Since he has lived experience, but he's also a clinician, he sort of started to talk about it. And I wanted to, ask you about that. Can you please explain what happens from the biological point of view? Like, we'll go through all of them, but when someone says that they have a genetic disposition to having an addiction, what does that mean?
Okay. I'm answering this because I want to get it out of the way, okay? The whole biological thing. And there is a reason I want to get it out of the way, but which I will come to later. So, dopamine is just one of the things which is a part of, the biological underpinnings of addictions. So let's just take the neurotransmitters first, okay? So the chemicals that help communicate within the nervous system. And so dopamine, or the happy chemical, as you called it, or the pleasure chemical, as people call it, it's a neurotransmitter which helps learning. It's not really a happy or a kind of a pleasure thing. So what happens is different things that we do lead to release of dopamine in the brain, and the greater the release, greater the learning that this is something that's good and I should keep doing it, right? And then, as you pointed out, different things will lead to different levels of dopamine being released. Substances which people get addicted to lead to those massive surges of dopamine, and the brain gets exposed to high levels of dopamine multiple times, right? And just having the neurotransmitter is not enough, right? There are receptors to which the neurotransmitter will attach, which then allows the communication to happen. What happens is that your dopamine keeps going up if you're, let's say, for example, using alcohol, and then the brain starts down regulating in terms of the number of receptors it has for the dopamine. So your dopamine is going up. The receptors that it's used to attach to, which did the communication, the numbers are going down.
Because they're like, too much dopamine is coming.
Yeah, exactly.
Okay.
Now what's happening is the tolerance bit of it, which I told you earlier. So now you're getting the surge, but it's not giving the same pleasure. So you have to keep increasing the surge, right? And whereas the receptors keep down regulating. And so the dopamine does the job of making you learn that this is a good thing. It also helps your brain connect itself externally to different cues that give you that pleasure, right? So that's where the triggers for using alcohol or craving comes in, right? So you know that, let's say we are drinking buddies, and we drink together, dopamine goes up, cues are getting formed that every time that I am with Ira, I'm going to kind of get to drink and going to get that pleasure, right? So
Neither of us drink, guys.
yeah, I couldn't even say coffee because that won't work
Doesn't
either.
drink coffee also.
And what the substance then does when you ingest it is basically you trying to avoid the negative effects of not having it, right? So you are now, basic function of that drinking is not to get pleasure, is to avoid the anxiety, the stress, and that's what you are now chasing. Now let's look at the structure of the brain, right? So the alcohol or the other substances that you use or misuse start affecting those parts of the brain, which allow you to, for example, control your impulses, which allow you to plan, which allow you to understand the consequences of your actions. Those parts of the brain start getting structurally affected. So that's the second piece of it, the functioning of the brain, the structure of the brain. Then there is the metabolism, right? Which is how does your body break down alcohol? And two people, let's say, for example, might drink the same amount of alcohol, will have different rates of breaking it down. So one would think that if my body is breaking down alcohol very fast, it's a good thing because it doesn't remain in my body for long, right? The problem is if your body is breaking down alcohol very fast and it's kind of getting excreted very quickly, you end up drinking more and more dangerously, right? Because it's not giving you the effect, it's just broken down very quickly. So you end up drinking more and more. And so the effects are greater. So whereas the person whom it's a slow metabolism, the effects are worse, right? You're not really enjoying it. It's, you're getting worse hangovers and all of that. And so their chances of kind of drinking alcohol problematically goes down. So that's the metabolism of it. And then the genetics of it. All of these three things that have spoken about are
because of the genetics.
Are being, controlled by your genetics. So anything that alcohol or gets you to kind of become, for example, dependent on alcohol, anything that's to do with how the alcohol affects your body, all of that is controlled by a genetic predisposition. The approximately around, let's say, like a rough number, okay, around 50% of your propensity to develop a drinking problem would be explained by genetics. But that does not mean that having, let's say, a family history, let's say my father had a drinking problem, grandfather had a drinking problem, just having that genetic propensity doesn't mean that it's my fate, that I will definitely go on to develop drinking problems, right? And that's where the whole biopsychosocial comes into the picture. What the biological bits of it does, which is the genetic propensity and then subsequently the neurotransmitters, metabolism, the structure of the brain, etc. What it does is it loads the gun.
Mm-hmm.
Okay, but the trigger is pulled by your environment. So you could have all of these things, and if your environment is not amenable to you developing drinking problems, you will not develop drinking problems. So you could have two people, let's say twins, same genetics. They grow up in completely different environments. One where there is, because they are seeing alcohol in their vicinity, the family drinking, and so there's modeling behaviors. Alcohol is easily available. There's peer pressure to drink when they go into college. Alcohol is inexpensive. There's a lot of advertising around them about alcohol. And let's say the other person, the twin, grows up in a parallel world which does not have any of these things, then this person, despite the genetic
I just want
similarities,
to add other things in that category of like other kinds of stress.
uh,
In the first twins' life, so they could be things that are related to alcohol, like access and advertising and all that, but they could also be just things like war or COVID or
absolutely.
exam pressure, anything.
Absolutely. Yeah.
Versus the second twin who has relative safety and stability and support.
Yeah, absolutely. So the first one will go on to possibly develop drinking problems. The second one will not. So genetics remain the same. So all of the biological stuff that I spoke about would be more or less the same. But the pulling of the trigger by the environment does not happen.
In one example, the gene gets expressed and triggered, and in the other example, it doesn't. Okay. So apart from that 50% that may or may not get triggered in your biology, what else affects whether you develop addiction or not?
One of the commonest things that we get to hear from the work that we do in terms of understanding why people start drinking and then continue drinking, one of the commonest thing that comes up is peer pressure. So to get started and then to continue. So a lot of people, especially young people, start drinking because if they don't, they are outside the group. And to become a part of that group and to be accepted, you have to drink. Right? So that's one example. A lot of the times, people drink because it serves a particular function for them. So, for example, if I go to a party and I don't drink, I don't feel confident enough to interact with people. And so drinking gives me that confidence. Drinking allows me to reduce my anxiety around people and about things. Drinking allows me to elevate my mood. Drinking allows me to improve my sleep, which is spurious. It doesn't actually improve your sleep.
You think it does.
You think it does. It sedates you, but the quality of sleep is not good. But anyways, that's what people think. Drinking allows me to. So for example, one of the other things that we found was a lot of the people who work in industries or workplaces where there's a lot of hard physical labor at the end, like in the construction industry, for example, or fishing industry. At the end of the day, the alcohol allows them to manage their body aches better and help them sleep. Right. So that's another example. And then there are things that we don't even think about, So, for example, there is clear evidence to show that greater the advertising of alcohol around you, like there's very clear evidence that shows that greater the density of advertisements, greater the alcohol problems in those neighborhoods. There's very clear evidence to show that greater the density of shops or stores that sell alcohol, greater the chances of developing alcohol problems within those communities. So for no reason, we kind of make these policy recommendations around like banning advertising of alcohol, ensuring that the density of alcohol vends or shops is kept low. The licensing mechanism, all of these things are designed to kind of reduce the environmental risks of people starting to drink and developing drinking problems. Then the norms around drinking, right? So there are kind of things called as wet drinking cultures and dry drinking cultures, right? Mm-hmm. And a wet drinking culture would be Italy, right, where people predominantly drink wine. They drink them with meals. You kind of drink it over a long period of time, right? I mean, you're kind of sitting having a meal and you finish a bottle over a substantial period of time. And there are kind of clear social rules around what you can drink, when you can drink, how you can drink, where you can drink, what you can do after you have alcohol. Wet culture, clear norms around alcohol. And then there are dry cultures, where people predominantly, so for example, is India. The predominant consumption is of spirits. It's not beer or wine. It's mainly spirits. It's drinking large amounts of alcohol with the intention of getting intoxicated. It's not, it's not because you kind of sitting with friends and having a good time. You kind of, the whole idea is we're going to get drunk and disinhibited. That's the expectation. So that would be your dry cultures, and that's where you kind of have more problems because there are no norms, right? There's nothing to tell a young person, let's say in a dry culture, like in the context is India, around what, how much, where, when they can drink, how to behave once you have had alcohol. None of those norms are set, and that's again a risk factor for developing drinking problems.
That's why sometimes people say, I'll teach you how to drink. Like sometimes, I don't know, like Dr. Azhar said that his granddad, I think, had told him that, let me teach you how to do it, rather than just.
Yeah, that helps set norms in some way, right? But it is an intentional thing. It can't just be I'll watch them drink and I learn from
No,
that.
yeah.
But I think the point to remember is that there's lots of different things in play here, and just one thing by itself is not enough. I mean, it's an interaction, an intersection of many things, which creates that perfect storm for people to develop drinking problems.
Some of the things that you mentioned did indicate psychological distress as well. So, like feeling anxious or having so low self-esteem. These days, some amount of conversation about addiction is also that, it's the solution to the pain that you're feeling. So it's not necessarily the substance that you want. It's that it's giving you something else that you are otherwise missing. And so, for example, depression can also lead to you developing an alcohol problem. I know you said there was no order of importance. Would you say peer pressure is as big a factor as mental distress?
Well, I mean, at least in the work that we have done, the peer pressure has come out the most endorsed in some way. But again, if you look at the prevalence of people having mental health problems versus the prevalence of people having friends,
Fair.
one could argue that the risks of peer pressure is like being exposed to peer pressure is much more than
the risk of being, yeah. Okay, well, then we won't pick one over the other. There's a spectrum of problematic drinking, right? So people can fall anywhere on that spectrum.
Just using the word addiction just makes it sound as if it's a binary, either you have it or you don't, right? But the reality, and when people think about addiction, they are thinking about the more extreme end of the spectrum. But in reality, for example, alcohol, the problems related to alcohol or alcohol use disorders, as we call them in jargon, broadly would have three buckets within them. So there is risky or hazardous drinking, which basically means that one is drinking heavily. And if they continue doing that, they run the risk, and that's where the risky comes from. They run the risk of developing physical health, mental health, social problems. Right? They've not yet developed problems. So, for example, let's say the young person who goes out with friends, drinks heavily, gets on a bike, and goes home. No problem yet, but the risk of them having an accident and a head injury or even dying, right? So that's the risk I'm talking about. Harmful drinking is the second category, which is where you already started developing problems: physical health, mental health, social occupational domains, right? You're drinking heavily, and your liver might be affected. You might be getting gastritis, or you might not be sleeping well. You might missing work days. You might be getting violent towards your family members, but you are still not dependent on alcohol. That is, if you decide to stop tomorrow, you're not going to get, let's say, for example, withdrawals. And then the extreme, the kind of the more severe end of the spectrum, is being dependent on alcohol, which is a lot of the things that I told you earlier when you asked me about addiction, which is the withdrawals that happen, and continued drinking despite all of the adverse impacts, knowing about the adverse impacts, etc. So that's basically a combination of physical, behavioral, and psychological components. So the physical would be, let's say, the withdrawals that happen when you stop. Behavioral would be kind of the constant seeking of alcohol, and then the psychological would be the craving, the strong craving or desire to drink alcohol, to the exclusion of everything else. I think that comes at the more severe end of the spectrum. But the problems are across the whole spectrum, right? Because each one.
I mean, I feel like even the first one has social problems where you might kill someone else on the street.
Yeah.
And so they all have larger consequences across biology, social life,
Exactly.
psychological life.
Each one has its consequences. But when we think about addiction, we just think about the person who
sits in the corner, has a whiskey glass, drinks all night.
Exactly.
And then throws up.
That's our.
Whatever they do.
So that's how you visualize it. And when that's correct. And then when I kind of talk about this, I say when we talk about alcohol use disorders, the general perception of people, they think about, oh, it's that man on the street who, like, late at night coming from the bar, falls on the side of the road, is not able to, doesn't know how to get home, and they'll sleep the night off on the road. So that's people's understanding of alcohol or alcohol problems. And I think the problem with that is when your conceptualization of a drinking problem is that extreme end, you think everything else is fine. And even if you're doing all of these other things, you think there's nothing wrong and I don't need to seek help. Or if you see someone in your family, they're like, oh, that's fine. They're not dependent. We don't really need to do anything. But at a population level, all three of these are problematic. In fact, it's like it's a pyramid, right? So the risky drinkers and the harmful drinkers make this, and the more dependent drinkers are this small bit. But the focus, both in terms of how we see the problem and how policymakers see the problem in terms of responding to it, is just the tip of the pyramid.
Whereas it's easier to do things about the lower halves, just like in all the other mental health conversations we've been having.
Yeah.
Okay. So, because the idea of this podcast is that, we do live in a large society and there will be systemic things that we cannot always control. In terms of personal agency, as an individual, if I had to try and do something about it, if I were to say notice any of these signs, what does that look like?
I think when I spoke earlier, I said I said that I would want to kind of get the biological out of the way right at the outset, and it's because of this, the agency. You mentioned agency, right? Because if we stress too much on the biological bit of it, then you're taking away agency and accountability for your behaviors, right? So it's important to remember that. So what can one do? I think the first thing is acquiring adequate knowledge, right? Unless you know that this is a problem, that's the first step. So knowing, getting curious, I think, and getting and getting that information is important. Second thing is acknowledging that there is a problem.
I think we should get into that, because it will be so difficult for me to see that I have a problem, right? And if getting to know about it, it's highly unlikely someone who has nothing going on is going to be like, hey, what signs do I need to notice about drinking alcohol? since you're here and we have you with us, can you go over just a couple of them? Like, for example, when we was talking earlier, you said drinking one peg a night across the week would be less of a sign of risky drinking rather than 5 in a day. Whatever.
Yeah.
I mean, those are kind of things that will not for sure, but it sort of gives you a little bit of thought in terms of how to spot risky drinking in your personal capacity. So like something Dr. Azhar said was that if he realized that he needed, when he needed to start to control his drinking, he was like, the fact that I had to control it is a sign that it could be problematic. So things like that.
Sure. Historically, the thinking around that has been the volume, right? The more I drink, the more problematic it is. And so when people judge, do I have a problem? They judge it based on volume. Like, I'm drinking X amount, so that's fine. I'm this much, then it's a lot. But recent advances, and not so recent, but kind of advances in science are now telling us that it's not just the volume that you drink, but it's the pattern that you drink, in which you drink, that makes the difference. And what do I mean by pattern? So one example that will contrast volume against pattern, right? So let's say I'm drinking one peg of whiskey or rum every evening before going to bed, every day of the week, right? So I go home, I have my meal, I have one peg of whiskey every day of the week. So that's one pattern of drinking. And then you have this other person who says to you, oh, I don't drink every day. I only drink on Saturdays. I work all week. Saturday is my off day. I go to the bar in the evening, meet friends. I drink 5 pegs of whiskey over that 1 hour that I'm sitting with my friends. I come back home, I quietly eat my meal and go to bed. Now, this person is drinking 5 pegs, that person is drinking 7 pegs. So in terms of volume, the first person is drinking much more. But the second person is drinking in a pattern which is more problematic, because they are drinking large amounts of alcohol within a very short period of time, which does more damage to the body and the brain as compared to the 7 that are spread out over the week. So I'm giving you an extreme illustration, but basically the volume in one is greater. And if we went by the older thinking of this, one would say that this person is at a greater risk versus
it also
the other
sounds like
person.
You're drinking every day versus I'm only drinking once a week.
Exactly. So I think that's something that is people need to understand. But people also need to keep an eye on how is it affecting my life, because at the end of the day, a lot of these things about how is this substance affecting my life, and that gives you a sense of
if
is
it's
this
a problem or
not.
I think when we did the episode with Dr. Shishadri about parenting in the digital age, he was also talking about, gaming addictions. I mean, we didn't get into it, but it came up, obviously. And, he was like, if I'm gaming and that is affecting the fact that now I don't have any friends anymore, I'm not being able to study, I'm not doing anything else, then it's a problem. But if I game for 4 or 5 hours a day, but I'm still going out, doing my workouts, playing a sport, spending time with my family, maybe I game more than the average person. Yeah.
And there's also nuance to that, Ira. So, and especially with behavioral gaming in particular, because there's, let's say, this one person that you spoke about, and it's affecting all of that, and they're probably doing it 7 hours. And then there's another person who is doing it for 15 hours a day, but they're a professional gamer.
Yeah.
Now that just changes the dynamic completely, right? And it's not an addiction; it's your work. And you might be kind of locking yourself up in a room and not having any friends, etc. But this is your job.
This is also what Abhijit does, but he just does it with mental health research. So it sounds acceptable and okay.
Oh, God. Okay. Oh, God.
But yeah, I guess checking if your life is essentially in a balance would be a good way to assess whether it could be risky behavior or leading to a problem or any of those things. So that was the getting information, being informed, and learning more about the thing, getting curious. And the second one was accepting it, you said. And I think that's sort of, I guess, where the shame and the stigma and the whole moralizing aspect of it would come into it.
It depends on the context, obviously, but I'm saying at an individual level, accepting that there is a problem becomes the first step. Because if you don't accept it's a problem, you're not going to seek help, right? So, in that sense, if we keep the complexities of that accepting aside, which is, as you said, there's stigma, there's shame, there's guilt. If we want to get a cleaner narrative, just to kind of map out the process, let's just keep those
The how.
the complexities aside, and let's say you accept it, and then the next step would be to seek professional help if it's needed. Managing or treating the underlying mental health problems, if there are any, which are driving the drinking. Strengthening your support systems, like intentionally strengthening your support systems. Developing alternative safe interests are some of the things that you do. You're kind of strengthening your social networks, and you're replacing the drinking behaviors with things which are not, risky, dangerous, or safer alternatives.
Habermas said, addiction is the progressive narrowing of the things that bring you pleasure. Yeah. So if you start finding joy in other things, it's less likely that you will do that only one thing again.
And that's the same thing that happens with agency as well, right? So it's not a binary that you have agency or you don't have agency. What happens in addictions is that your agency starts constricting, right? And your choices start narrowing.
It gradually becomes less and less and less.
Exactly. And so the whole point of some of the interventions and recovery is kind of expanding your choices and your agency.
Which is also what therapy does, which we discussed. So in the Radhika episode and the Nuzat episode, which were on two very different modalities of therapy, the end thing was that what therapy is trying to do is not fix your problem. It's just trying to show you have more choices than you thought you did. Right. And even if all of them are not very great choices, you still have a choice, and there were more choices than you thought you had.
Just knowing that you have more choices in itself is empowering, right?
Okay. So there is a higher emphasis on minors and children not drinking or not, like you said, in the whole peer pressure thing, starting to drink earlier on has makes it more likely that you may develop an addiction. Why? I mean, is that true? And if yes, why?
It's true. It's absolutely true. And the reasons for that is all of the things that I spoke about earlier biologically are the things that start playing out at that age, because all of those systems are still immature and developing, right? So the synapses or connections in the brain are still developing, right?
What you feel is safe or good is you're figuring that out as you grow up.
So that's the psychological bits of it. But even at the biological level, the connections are still developing, and what they're called as, plastic. They can change. Mm-hmm. They're still not fixed. Yeah, they're still not fixed yet. The structure of your brain is developing. So any kind of substance which influences this can effectively rewire the brain.
So 25 is when the brain is fully developed, approximately?
That's what you used to say. Now we kind of saying the new science is saying that brain keeps on developing. So let's not get into that. Okay. But it's at the greatest risk, because that's when the most cutting, pruning, connecting of those networks is happening. At a younger age, all of that is happening, and this substances interfere with that, could rewire them the wrong way, could kind of get them used to high levels of dopamine, which the brain is not built for at that age, etc. So that bit of it is happening. The second bit is the structural bits of the brain, which allow you to manage impulses, to make decisions, to think about safety, to plan. all of those parts are developing as well. So when those get exposed, those decision-making powers, those abilities to plan, etc., gets influenced.
So in words where that most of society cares about, you get bad marks in school if you started drinking earlier because...
But there are longer term impact
Yeah,
than just
no.
what's happening in school.
Of course, but like in the stereotypical depiction is that, you don't study, you just drink, and then you do badly in school. So it may not necessarily be that they're stupid and doing badly in school. If they're drinking, then it is actually changing the structure of their brain, and therefore whatever capacity they may have been, may otherwise have had, is being impacted.
Yeah. And the third thing that happens is the brain learning at that young age, that a brain and the young person learning at that age, that this is a good way to cope. So your learned coping response now becomes
alcohol,
using a substance, right? So your ability to process emotions, difficult thoughts, etc., does not develop. So quite a few things happening at that age because of the immaturity. And when I say immaturity, not the way we kind of think,
not in a moral manner, not good or bad. Just you're growing, you're developing.
Yeah, exactly, you're developing, and all of that can have longer term impact. And there is again evidence to show that earlier you initiate drinking, the greater the chances of developing drinking problems in the future as an adult. That doesn't mean that everyone, obviously, who starts drinking early will go on to develop the problems, but the risk is much greater as compared to someone who starts drinking later. And hence the logic behind the policies on legal age for drinking, right? I mean, it's not something arbitrary. There's a reason why these policies are there.
There's a reason why they tell you to wear a seatbelt, but nobody listens to that either. Yeah, and just to highlight, what you said about developing coping mechanisms is because, like you said, also developing interests, right? So if from an early age, my coping mechanisms, which could have been going out and playing sports or meeting my friends or drawing or any of those other things that would otherwise help me cope with my feelings, cope with, anything like low self-confidence or whatever it is. I may learn things that make me feel better, that will help me as I get older to continue to know what makes me feel better, what works for me and what doesn't. But if from when I was growing up, I started to use alcohol and it worked, then that's all I've learned. So then when I grow older, now I haven't even learned the things. Yeah. So now I have to start learning the things that otherwise I would have started to learn when I was growing up. But then, and this is specifically what you do some of your research in, is how do you convince kids to not start drinking early?
Yeah.
I guess just make sure they have enough to do that they find fun and interesting and safe. For the people who are using substances primarily as coping, in the sense that, either they're struggling with depression or they're struggling with some other sort of mental illness or just distress, they are most likely drinking to get relief from that. And then there would be a different group of people who, maybe started it out of peer pressure and then slowly developed a problem with substances. Would you say that the treatment process would be slightly different?
So, 2 points I want to make before I get to the treatment bit of it. So one is that the relationship between mental health problems and alcohol use. There are broadly 3 pathways through which that happens. So one is where the mental health problem comes first and you use alcohol as self-medication. The other pathway is where the drinking problem comes first and that causes the mental health problem. And the third is where there is a common pathway which is driving both. Let's say, for example, I'm a victim of domestic violence. That's driving my depression independently. And to help me cope with the violence, I'm also drinking alcohol
So
to
I have
forget
a
about it.
third horrible thing happening to me, which is causing my mental health issues and my substance use.
Exactly. Now, the thing with self-medication or drinking alcohol to make you feel better or cope with it is it works until it stops working, right? And which is not too long, right? At some point, it stops working and it just makes things worse. So, with regards to treatment, three ways of doing it in terms of how the treatment can be organized. So again, historically, in different parts of the world, this happens in one of two ways, which is one where there's again evidence for this as well, where you say that let's treat the drinking problem first. You treat the drinking problem, and let's say the person reduces or stops the drinking, and then you review after some time. Many times, if the mental health problem is secondary to the drinking problem, it will go away and then you don't need to do anything. So the treatment is sequential. You treat one first, then you see if there's a need for the other. Then the other way of doing it is parallel, right? Let's say I've got drinking problems. I go to you for my treatment of depression, and I go to someone else for treatment of my drinking problems. Two different systems. And that's how these systems have been organized historically. But the understanding now is that you need integrated treatment. So if I come to you, you have to be an expert at managing both and the interaction between the two. And so the treatment is not of the, let's say, depression or the alcohol use disorder. There's a treatment of the depression and the alcohol use disorder and how the two of them interact with each other and have an influence on each other.
So either you find one person who can do both, or you find two people and make them talk to each other.
That's the second way, which is you have it in parallel. They might be they might be talking to each other, but still one person is delivering intervention for depression, one for alcohol use disorder. They're not necessarily providing you something which takes both into consideration.
Will you find someone these days who can do integrated care?
Difficult, but that's the aspiration. Or that's the best way of providing care in situations like this.
But if you can't find one person, then you find two people, and then you say, hey guys, we sit in a room together, all three of us.
Absolutely. You can't let the best be the enemy of the good. The best is integrated treatment, but in the absence of that, you can do what you suggested.
Okay. So what is the treatment? Like, okay, if you took the extreme example of in the people who have an addiction category, they will obviously be the withdrawal symptoms that you have to deal with. So there'll be a whole bunch of physical stuff that has to be dealt with. So that could be part of the treatment. But then what's the other part? So that I've seen, they give you some medicines. It's supposed to help you reduce the craving. It's supposed to help you like not throw up or whatever happens when you get anti-seizure. I don't know. There'll be some medicines, right? And then after a bit, those medicines will stop. And then the person has to not drink. And that happens by keeping them distracted.
Lots of things. I think, again, because we are speaking about biopsychosocial causes of drinking, similarly, treatment also can be categorized into those, right? I mean, we are only talking about the more severe end of the spectrum now, people who are dependent. And so there is a role for medications in this case, the more extreme end of the spectrum, and there's a role for psychosocial interventions, right? Again, just like earlier, let's get the biological out of the way. Medications, broadly two types. One are short-term medications that you would give someone who has gone into withdrawals to reduce the intensity of the withdrawals because it's very distressing and can also be fatal if not managed properly. So those short-term medications to manage that, stop the tremors, sleep well, stop the vomiting, all of those things that you do. Short-term, 5 to 7 days, generally people are out of the withdrawals, which is supported, safe, under medical observation. Then the second block of medications, a bucket of medications, is the anti-craving medications, which some people might get, some people might not get. But the idea is to, as the name suggests,
Help
stop
with
the
the
craving,
cravings.
right? So that's the second bucket. But the hard work is in the psychosocial, okay? And generally, just medications by themselves are not helpful. You need to combine them with psychosocial interventions, and the psychosocial interventions are basically various different kinds. The
Who do
idea
you
is to
go to?
get people into recovery.
Do you go to a psychiatrist or do you go to a psychologist?
uh, you could go to the first bit, obviously the psychiatrist, the medications bit of it. The psychosocial bits of it, if the psychiatrist is trained, then obviously you can go to a psychiatrist. If not, you go to a psychologist. The idea is to get the person onto recovery and keep them there, right? The easiest part of treatment is getting to stop the alcohol. The most difficult part is remaining stopped, right? Because recovery is a journey, right? When you say, I'm going to stop my alcohol, it's a single decision. Whereas recovery is you're making small little decisions on a day to day basis, right? And what could these decisions be? They're around reducing your risk factors, right? You're reducing the triggers that could make you relapse. So, for example, if I used to drink
Stop
with my
hanging out with
friends,
Ida.
stop hanging out with the friends with whom you used to drink. Stop going to the places where you used to drink. There are lots of different triggers. So thinking through what the triggers are, and then thinking through how can I avoid those, and which is not always possible. How do I avoid Ira? I can't, because I have to do a podcast with her. So if I can't hide from Ira, how do I manage the situation when Ira meets me and says, let's go for a drink? What do I do then? Right? So thinking through mitigating those risks, avoiding or then mitigating those risks. Those are kind of reducing the triggers. Then enhancing your strengths, right? Kind of building social networks which are non-drinking, getting support systems around you who will help you if you slip and have a lapse. Um, Finding other activities which are pleasurable but do not involve drinking. Understanding that recovery is a journey and that if sometimes you might slip because it's a chronic condition, sometimes you might sleep, sometimes you might lapse, but that does not mean that you're failed, right? You can come back onto the journey of recovery. So the one of the big things that happen when someone slips, like let's say I've stopped drinking for let's say 6 months and then I have a drink. I start feeling guilty that I failed myself, I failed my therapist, and I said, "No, what's the point? I'll continue drinking." And so that lapse or the slip becomes a relapse, which is continued drinking. So understanding that if that happens, I have to go back to my therapist. I don't have to feel guilty. My therapist is not going to blame me for this. We'll work together and get back on to the road to recovery. So these are some of the things one needs to do, like understanding the recovery journey, that it's the long haul, that you have to be kind of making decisions on a day-to-day basis, from a moment-to-moment basis. It's not just about stopping the drinking, and then making those things happen and building supports around you. I think those are the most important parts to do as a part of the psychosocial bits of it for dependent drinking. For harmful drinking, where as I said, you're not yet dependent, but it's causing you problems, it's there's not much of a role for medications. There might be to some extent on the severe end, but generally there is not much of a role for medications. It's more of the psychosocial things and more or less the same things that I spoke about earlier. Finding alternatives, building support systems, all of those. And for hazardous drinking, which is the risky drinking, you're not yet developed problems, there's something known as brief interventions, which are very quick, short conversations that healthcare professionals can have with that person who drinks hazardously, which is basically apprising people of their drinking and how they are drinking, how it compares to the norms around drinking, what could happen if they potentially continue drinking, and then what are the skills that they would need to stop or reduce their drinking, right? Because many times people might not have the skills to do it, right? It's like simple simple kind of techniques that you can share with people. So for example, if I drink heavily and I go to the pub or the bar to drink, simple things such as I have a meal at home before I leave.
Drink a glass of water between every drink.
Drink a glass of water between every drink, or mix a soda with it, right? More of soda water than the alcohol. Only carry as much money as you need for the amount of alcohol that you said you'd consume. So these are simple, like common sense strategies that can be taught to people, which people don't think about it. So some of these techniques and strategies can be taught to people so that they can reduce or stop their drinking. And just that first part of that, when I said you apprise people of the norms around drinking, right? Because generally, what happens is when I'm drinking, and when I appraise my situation and I'm thinking, like, how does my, when I'm kind of reflecting on my drinking, I'm thinking, how does my drinking compare to, other people like me in this community, on this population? People generally underestimate their own drinking. They think that I'm drinking this much and I'm drinking this much and the rest of the population is drinking this much. What you do in explaining the norms to them is actually use the evidence around in that population to show that what you in fact are doing is more than what the rest of the population is doing, and people never realize that. And that's the kind of the cognitive processing of it, right? You kind of thinking, I'm not doing as much, everyone else is drinking more than me.
As someone who has been through phases of feeling low because of my depression, everything you said right now sounds exhausting.
In terms of doing it?
Yeah.
Uh-huh.
Yeah, I just feel like turning to the audience and being like, one step at a time. You don't have to do it all together.
No, absolutely, I agree. I mean, and independent of having depression, I mean, even for someone who does not have depression, getting onto the road of recovery and staying there is hard work. It's not easy.
And you talked about relapse, and this also came up in the Dr. Azhar episode, that, every time you relapse, it gets harder and harder because you get more tired of restarting that process of recovery again. And what I brought up then, because that's something that really stuck me with my journey, is that if you put that psychosocial support and that post-op care in place the first time, there's less likelihood of you relapsing. And then the whole process becomes far less tiring.
But no guarantees, right? Just
No. But of course not. But things will happen. Yeah. But percentage-wise, it increases the probability.
One would think so that if you have put a strong, safety network around yourself in terms of social support, then the chances of recovery are greater. But even if you relapse,
psychosocial support.
Sorry?
Full psychosocial support.
Yeah. And even if you relapse, the chances of coming back,
because they'll help. Yeah. So, not that that'll reduce. It may reduce the chances of relapse, but even if you then do relapse, you just feel less horrible about it. Because
getting up and starting to walk again is less tiring.
So the sooner you admit it and then get help and then do the first round of getting help sincerely, the less tiring and exhausting the whole process should be. Cool. Sounds good. We'll do that. There's a lot of stigma around addiction. And that is one big thing that sort of comes in the way of seeking help and admitting it to yourself and being able to admit it to other people. So one, I was wanting to know what the biggest myths about addiction are that you would like to bust. And the second thing is that while there are myths about it, it is true that someone who gets addicted to a substance then starts behaving in ways because of that addiction, right? So like you said, their world revolves around it. So they might lie about things. They might not be able to wake up and take responsibility of the household chores or whatever it is that they were required to do. They might get violent or aggressive because they're cranky, all of those things. And so it's not necessarily easy for the caregiver or their loved ones to navigate this situation and to sort of deal with them. And so even after you realize it's an illness and it's part of this is not their fault, it's a difficult balance to strike. So first, what are the myths you want to bust? And second, if there's someone who's listening who has a loved one who's struggling with an addiction, what's the most helpful thing you would say to them?
I think one myth that still persists is that this person drinks because they don't have the willpower to stop, or they could stop if they wanted to, but they don't want to. And I think we don't really need to bust that after the discussion that we have had around, the biology of it. I think what's important to remember is that biology is important, but it can't be used as an excuse, and you have to take agency into consideration. And it's the two of them working together that makes the difference. So it's not just someone being weak or lazy or not having the willpower. I think that's a big myth that still persists, and hear it quite commonly.
I think the biology sort of helps you with the acceptance part.
Yeah.
And then it's okay, now what is the whole other agency, psychosocial aspect of it?
Yeah. So accountability while accepting that there is kind of biology involved there, I think is very important. The other one is basically thinking that once you stop, you're good. And you see that many times amongst those who have stopped drinking are on the path to recovery for the first time. That confidence that I've now stopped it, then it's going to be easy. I'll never drink again. That's what many times is. I'll never drink again, doctor. I mean, I'll be fine. I think understanding that recovery is a journey, that it's a chronic condition that you have, like you would have diabetes or hypertension, high blood pressure, etc. And there are going to be, ups and downs, and knowing and preparing for those downs so they can respond to them appropriately when they happen is very important, rather than fumbling when it actually happens, right? So I think that's another common myth that, once you're done, you're done.
So you would say it's chronic?
Yeah, no, absolutely. It is like any other chronic condition like diabetes. There are going to be ups and downs. There are going to be fluctuations, and you have to be ready to kind of manage those. There's this other thing that I commonly get in clients that I see where with drinking problems, where they will say, "Oh, but I drink only the good stuff." That I don't drink, let's say, for example, country liquor. I drink scotch, right? I know, but again, there's this thinking that it's the quality of the alcohol that makes the difference. Quality of alcohol does. I mean, like, say, for example, spurious country liquor will do kind of a different kind of a damage. But if you're looking at spirits, it doesn't make a difference. Spirit is a spirit. I think the first and most important thing to be able to, that family members should do, is to be able to separate the person from the behavior. I think that's the first step. The moment you start thinking interchangeably about the drinking problem and the person who drinks, that's, you're not able to then separate out the emotions. So being able to think that, okay, this is a person and this is the behavior. The behavior is the problem. The person is not the problem. I think that's the first thing to do. The second thing is helping them with all of the other things that I spoke about, right? So helping them build their social networks, being available for them. There are ways in which you can involve the family member in therapy. So for simple things like if I'm the drinker and if I have decided that that I'm going to do controlled drinking, and that if I go out to a party, I'm going to have one drink. So I can now recruit my family member in this and say, listen, when we go out to the party, if I have the first drink and I go for the second one, you have to remind me that this is what we decided to do. Like
Don't
this.
shout at me, but remind me.
Remind me. Yeah. So that's another thing that you can do. Setting clear boundaries without being dismissive, I think is very important. So, for example, you can come home after having drinks with your friends, but hitting me is not acceptable. Like setting very clear boundaries. If that happens, this will be the consequence, right? So clear boundaries with consequences, very important.
Right, the consequence has to actually happen.
Yeah, I mean, in the absence of which the boundary won't
Will
work,
keep getting
right?
violated.
Yeah. So setting boundaries is very important with consequences. The other thing is when rescuing the person all the time when problems happen doesn't help because it reinforces the behavior. So, for example, simple example, I have drinking problems. I drink out and I go home. I reach at midnight. And if there's no food on the table, I'll go and sleep on an empty stomach. So, my family member who kind of looks after me, spouse, partner, whoever, ensures that she's there awake till 12 midnight until I get back home, hit
sure
my
that you
food
have
for
food.
me, sure that I get my food. So don't rescue, but don't abandon, right? So you say, listen, I mean, you come late, I can't stay up till late midnight, I have work to go to tomorrow. I'm going to keep the food on the table. You can heat it and eat it. Right. So you're not rescuing them, but you're not abandoning them as well as saying that there's not going to be food. If you turn up at 12 midnight, I'm sleeping, you're not going to get any food. Right. So that's very
You'll
important
cook
to
the
do.
food for them, you leave it in the fridge and be like,
Yeah, you take responsibility for feeding yourself. Very clearly understanding that I didn't create the problem, so I don't have to beat myself up for it. I can be a part of the solution
you as in the care.
as a caregiver, right? I didn't
not
create
your
the
fault.
problem. It's not my fault, so I don't keep beating myself up about it. But I'm happy to be a part of the solution. That's very important to kind of think through. And finally, remembering that as a caregiver, while you're helping the person who has the drinking problem, your own well-being is also very important. I think that's something does not happen quite a lot in our context in India. You either kind of say, there's no point, I can't do anything about this, let them figure out what they want, or you kind of get so involved in it that your own well-being is compromised and you don't think about your own needs. You're only thinking about that person's needs. Like, what do I need to do to keep them safe, keep them healthy, reduce the risk, without understanding that this is having an impact on you. Because if you are not well, then you can't take care of anyone else, right? So being mindful of the fact that my well-being is also important is very important.
I feel like, again, very specific to me, but like my depression made me just not move, not do much, which is much easier to deal with for an outsider than someone being impulsive or rash or aggressive or, and so then for the caregiver or the person taking care of them to be able to, like you said, find the balance between this is the person, this is the problem. Don't get annoyed with them when they maybe keep doing the same thing again and again. In the sense, set your boundaries, but don't get annoyed with them. So it's not the same thing. You can be very strict with your boundaries and still be compassionate to them. And so I think understanding that, especially, I think that, also helping people articulate what that looks like. Because if I tell you, hey, set your boundaries, but with compassion, you're like,
yeah. No,
what does that sound like?
Absolutely. And this point that you made about compassion is very important. That love is very important, but it's not enough by itself. And so you need all of these strategies and helping think the family members through these strategies. And you're right. I mean, unless you teach people how to operationalize those within their context and what is possible within that context, it won't work. And I say operationalizing it within the context is very important. Is that it's, for example, it's very easy for me to say that you set boundaries and there are consequences. But if when you set the boundaries, the husband beats you up, then that's not a viable solution for you, right? That's one of the big challenges that we face when we work with family members here in the Indian context, is if setting those boundaries or having consequences around that, or if she doesn't stay up till midnight to give them food, that a man will come in and beat her up, then it's not a viable solution. So this thinking these through requires help and support.
Yeah. It's complicated.
It is.
The thing that I wanted to ask you, because we had this conversation and it's going to be a fun debate. This is what's going to make people either leave this episode or...
That's why you're asking it last.
That's what I'm asking it last. So there have been various newspaper clippings and articles and Instagram posts and things that tell you one glass of red wine every day is good for your heart. And you said no. And to differentiate that, while one glass of wine every night won't kill you, it's not doing anything good for you. So is that true? No amount of alcohol is good for you.
So what you're talking about, that one glass of wine or whatever is good for, it's not good for you, it's good for the heart, is the thing that used to be the case. And that was evidence. There was evidence around, there was science around it. But in more recent times, people have tried to disentangle the science a little bit to understand how good that science or how applicable that science is.
Yes or no, Abhijit? No amount of alcohol is good for you.
Do you want a headline or do you want the news that comes after the headline?
I'll attach the links in the resources below.
So let me keep this short. There's problems with the evidence, and you can't take it at face value as we used to take it. And even if the evidence was true, that a little bit of alcohol is good for your heart, it just means that you would die with a good heart, but everything else is not working, right? Because the liver is still getting affected, your stomach lining is still getting affected. So there is no net benefit. There's benefit to the heart, but every time you consume alcohol, your risk of cancers go up, right? So the current understanding is that this is what you want to hear, that no alcohol is good.
I don't want to hear it. It's just found it was like the conviction with which you said it was so impressive that I was like, okay, then we should. People should know.
You build the background and then you say no amount of alcohol is good. The thing is, you can't stop people from drinking alcohol. What we can urge people to do is to understand the trade-offs that you're making.
Yeah. This is not to say stop drinking alcohol. It's just to let you know that no amount of alcohol is good for you.
Yeah.
Drink what you want. Coke is also, I don't think any amount of Coca-Cola is good for you. You can still drink it.
No one is putting out messaging saying that there is something called a safe Coca-Cola. Whereas with alcohol, that's the problem. There's messaging that says that there's something called a safe drinking limits, right? But in reality, there is no such thing as safe drinking limits. What you can have is low-risk drinking, right? Safe drinking limits implies that there is no risk drinking. There is no such thing as no-risk drinking. There's low-risk drinking.
All drinking will have risks. Exactly. Less drinking will have lower risks, and more drinking will have higher
And a lot of the safe drinking narratives have been, pushed by industry and all of those other kind of the political economy around alcohol. But bottom line being, no alcohol is safe.
Cool. Got it. Okay. Thank you so much for all of that and explaining it and taking us through it. I think it was quite helpful. Especially, the operationalizing things is the part that we often skip. we're always like, do the thing, and then we just leave them there. But it's really helping people figure out within their context, in what they are going through, what is actually doable and possible, which is sort of where I feel like short form becomes unhelpful, because most people kind of on some level may get it, but they don't necessarily know how to do it.
But that's true. Like, I mean, if you're doing therapy, I mean, if your therapist says set boundaries, then it's a bad therapist. A good therapist would say, we need to set boundaries. Now let's sit together and figure out how you can set boundaries, like what's possible for you.
I meant like Instagram. I meant like when you read about things, or when you talk about things, in my opinion, the difference between therapy and doing it yourself is that sometimes the symptoms make it hard for you to do it yourself, and sometimes you've not been taught the skill to do it yourself. So it's not whether you need therapy or you don't need therapy, emotionally speaking. Sometimes just on a skill knowledge level, you need someone to sit with you through it. So I think that was helpful and came up. And so yeah, thank you. We end each episode with a little activity with some stationery. It's called The Little Things, because at Agatsu we are trying to help people figure out that building a habit of shifting your perspective can be helpful. And so the idea is that you get clipboards and you have to write down one thing, at least one thing, that didn't go badly. It could have gone well, it could have gone interestingly, curiously, anything, just not badly, from this morning to now. Okay, Keely, my kitten, curled up on my lap and purred. That was my good thing for today.
And then he came and scratched my hand.
See now, that's your problem. Okay, what's yours?
I got to miss meetings because of the podcast recording.
How fun! I think that's a great answer. Thank you for watching The Curious Case Off with me. In the description below, there will be links, further reading, summaries, guidelines, resources, everything that we could find and put together that we think you might find helpful. Just to reiterate that everything that is said in the episode, as well as in the resources below, should not be used to self-diagnose. If you have any questions or queries, please reach out to a mental health professional who is qualified. And if you like the episode, then like, share and subscribe to Agatsu Foundation, our YouTube channel. And if you want to know anything more about the organization, then you can find out at www.agatsufoundation.org.